Hello everyone, welcome to the Obesity Institute official launch here at Leeds Beckett University. We have a very special day today, which is World Obesity Day. I am Saeeda Bashir, the Principal Consultant of the Institute, and I'll be leading you through our programme today. We are celebrating a new era for obesity research, education and knowledge exchange here at Leeds Beckett, and we have worked with our colleagues right across the university and our key external partners to develop a strategy that speaks to the vision of our Vice-Chancellor, who has inspired and supported this work. So this new Pan-University Institute takes a fundamental step change in the study of obesity. You'll hear PPI&E mentioned throughout the event this morning, and it refers to patient and public involvement and engagement, which is quite a mouthful. What this means is that what we will be doing is we will be placing people with a lived experience of obesity and overweight at the heart of everything that we do. That goes beyond the traditional PPI in research and actually informs all of our activities. So today you'll hear from our Vice-Chancellor on his vision for the Institute and how it will meet the complex challenges of obesity. We also have for you this morning a new animation video presenting our overview of our strategy. We have a special pre-recorded World Obesity Day message from Professor Jason Halford. He's the president of the European Association for the Study of Obesity. Sadly, he couldn't be with us this morning because he is running other events in Turkey. And we will hear from our very own Institute directors, Professors Louisa Ells, Paul Gately and Carlton Cook. Paul will give us an introduction on PPI here at Leeds Beckett, and he will be followed by Ken Clare. Ken is our PPI lead and will talk about our PPI hub. He'll be followed by Louisa, who will speak to our research strategy. And last but not least, we will have Carlton lead a panel in some Q&A. So if you do have any questions this morning and you would like to raise one for the panel session, please do use the code #LBU Obesity Institute via the website Slido. That's www.slido.com, and the details were on the holding slide. I also encourage you to find us on Twitter using the same hashtag. And that's really it. I hope you enjoy the morning. It is an absolute pleasure to be here today and a pleasure to welcome our Vice-Chancellor, Professor Petersley. Over to you, Vice-Chancellor.
Good morning, everyone. Welcome to the formal launch of the Leeds Beckett Obesity Institute. There's never really been a better or more appropriate time for our university to make this commitment. The World Health Organization warns that obesity is reaching pandemic status. Almost 40% of adults worldwide are now living with overweight and obesity, and that number has tripled in a generation. This matters because obesity is a growing indicator of health inequality, and it manifests itself in chronic ill health, declining productivity, and often premature morbidity. Our university is an established global leader in research about the complex causes of obesity, a global leader in informing national policy on obesity reduction, and a global leader in developing effective interventions which work at scale. The Leeds Beckett Obesity Institute will not only bring together outstanding researchers from a range of disciplines, but also More Life, a world industry leader in developing whole system patient-centered approaches to treatment, and also Obesity UK, which represents the patient voice. Our institute, therefore, will foster the cross-disciplinary research that we need to understand the complex and interrelated factors which cause obesity, and help us to develop and refine effective weight management programs at scale, and to influence national and international opinion and policy. Our university's vision is to deploy our expertise and resources so that we can make a positive and decisive difference to people, organisations and communities. Our Obesity Institute is the very embodiment of this vision, and I wish everyone who's working with it the greatest of luck in the years to come. Thank you.
Obesity is a highly complex disease driven by many varying factors. Therefore, providing effective solutions and support for people living with obesity requires the skills and expertise from many disciplines and sectors. The Obesity Institute brings together these different multidisciplinary skills, drawing on the academic and professional expertise from across Leeds Beckett University, and also our wider academic, policy and practice partners to address these modern challenges of obesity. The Institute has one clear vision: to improve the lives of people living with or at risk of obesity. All our work is underpinned by our public and patient involvement and engagement hub. This hub will ensure we have a person-centred approach to our work so we can listen to the voices and see the impact of real lived experiences in collaboration across diverse communities. The Obesity Institute will continually evolve, creating accessible and inclusive programmes of work in areas such as prevention, systems science, health inequalities and treatment. The Institute will have 3 key areas of innovative activity: research, education and training, and knowledge exchange. Our core values are showing care, compassion, collaboration, effectiveness, equality and inclusion in everything we do. We want our work to be useful to both the wider public and the individual people that we serve, and to develop a new generation of compassionate, person-centred professionals. To find out more about the Obesity Institute and how it is changing the conversation and landscape around obesity, visit leedsbeckett.ac.uk/Obesity Institute or follow us on our social media channels.
Hello, I'm Jason Halford, President of IASO, and welcome to World Obesity Day. I'm delighted to talk to you today at the opening of the Obesity Institute at Leeds Beckett University. Now, obesity has finally been recognised as a chronic relapsing disease, as well as a gateway to other non-communicable diseases. However, there remains a tremendous stigma associated with obesity, and people living with obesity struggle with their own weight, not seeking help but soldiering on their own, believing it is their own fault and they have to find their own solutions. And healthcare practitioners often struggle understanding whether their patients are motivated or not, and wait for disease indicators to manifest before they have those discussions. People with obesity would welcome those discussions far earlier if they were in a respectful manner. Now, access to specialist treatment is limited, and often we see both people living with obesity and also healthcare practitioners rely on traditional methods such as diet and exercise, but these really do not take into account the biological causes of obesity, including genetics. Obesity remains a global public health issue, and it underpins many health inequalities in the UK. The obesogenic environment is a real issue for all policymakers. Unhealthy food is promoted in a variety of ways, through pricing, through advertising, through advert games, through the use of celebrity endorsers, through the use of social influencers, and the food system is designed for delivering an excess of calories rather for delivering good nutrition. Now, obesity is a global problem, and it's linked to the triple burden of malnutrition, micronutrient deficiencies and obesity itself. And we see that globally, but we also see that in household food insecurity in the north, including the city of Leeds. Well, why this institute and why Leeds Beckett? Well, Leeds Beckett has a very long history of working in nutrition and working in exercise and activity in the context of weight control and weight management. And for years, colleagues have been working at Leeds in terms of interventions focusing on children at many ages and also their families. And these interventions are very comprehensive. They also have a strong track record in policy and prevention and advocacy for people living with obesity. People at Leeds, this institution, have been instrumental in developing not only national but European and global guidelines, recommendations and other instances of best practice. And they are known for campaigning for the rights of children living with obesity and also people living with obesity, particularly in underrepresented communities, so that they get access to the services that they need and the services that they want. So sorry I could not be with you today in person. I'm in Turkey on World Obesity Day, but I am really proud that this institution is in Leeds and it reflects the work of colleagues at Leeds Beckett that I have known for the past 25 years in my professional career. So good luck everybody and have a good World Obesity Day, and I hope to see you soon, and I hope to see this institute flourish over the next 10 years, and I look forward to seeing that as well. Thank you very much. Goodbye.
Thank you very much, Jason. It's so wonderful to hear from you, and we're really grateful of your contribution. I've known Jason for 25 years. I've been one of those people that have known Jason and worked with Jason, and are delighted for him to support the launch of our institute today. I just want to talk a bit about our sort of PPI and the work. In many ways, it's always been at the DNA of the work we do at Leeds Beckett University. I remember in my undergraduate dissertation many years ago in the mid-90s, where I had a quote which was from a young person that I worked with, which was, "My doctor told me I was going to die. I don't go to him anymore." And I think in many ways that really sort of helped me understand this sort of challenge that unless we understand the needs of young people living with obesity, unless we understand the needs of people living with obesity, and unless we work with them and understand how they are hearing and taking in some of those messages, we can't really help them. So PPI has always been really important. In our early days in delivering weight loss camps for children, which were in many ways controversial, our children and what they and their families' lived experience was a critical feature of how that programme evolved over 20 years. And it was also a critical feature of the lessons that we learn. Much more I learned from those families and those children than what I learned from many of the texts that I read over that period of time. So it's always been a key feature of what we do. And then as we transitioned, as the UK policy work did around working in communities, working in specialist centres, delivering obesity across the NHS, we also started to realise what a critical element of engaging with young people and all people living with obesity was. And at the same time, I was fortunate to be part of a founding member of Obesity UK, and Obesity UK is a member organisation that puts the voice of a person living with obesity right at the heart of what it's been doing, and that organisation is a partner to our institute and is still going strong 10 years later. I guess more recently what we've realised is despite this work being a core feature of anything we do at Leeds Beckett University, we've recognised the need to be much more formal, much more systematic, much more focused around a hub that really does concentrate our efforts through people living with obesity. And so I was delighted for Professor Louise Orels to join us and really start to help us formalise this work, and then obviously bringing on board Ken, who you're going to hear from in a moment, who has been a trailblazer in this space for so long in really driving the agenda forward. And I feel as though every time I despite being in this area for 20 odd years, I still learn something from Ken with those interactions. And so for me, the formalization of that, creating a hub that systematically works through our research, our knowledge exchange, and how we then deliver that in our teaching through our students, for me, is absolutely critically important. And whilst it's always been part of our vision, it's not necessarily been as formalised and as strong as it could be. And so I'm delighted that that now is a core feature of what we do to move our institute forward. And at that point, it gives me great pleasure to introduce you to Ken, this trailblazer, this supporter, and this, you know, this person that really is a very strong voice for people living with obesity. Over to you, Ken.
Thank you for that introduction, Paul. And I'm delighted to be here this morning. I'm also delighted to say, next slide, please. Just to give you some background, because I think it's really important that people understand where I'm coming from. I have a personal lived experience of obesity. As far back as I can remember, my mum was on a diet and she yo-yoed between, I think, 12 and 25 stone all of her life. As a child, I was living with obesity. She always had me on a diet. She had me to the doctors. She had me to the specialist hospital. And my age matched my weight in stones till the age of 18. And all through me adult life, I struggled with weight. And I was a good dieter. I was yo-yoing, but I could never maintain. Professionally, I went off to be a mental health and general nurse, and I've got 40 years as a nurse in my DNA, I think some people might say. But I think that's important to understand where I'm coming from. And I retired early from the NHS. I entered weight management in 1999, and I think that was a crucial time for me. And we're blessed in Liverpool at that time to have a good Tier 3 weight management service. And I had bariatric surgery in 2002. And there was basically, at that time, I don't know if people can remember a world before Facebook and social media, but there was nothing. And so I set up a charity and an information forum. It was very rudimentary when I look back at it, but it achieved a lot for about 25,000 people till we were lucky enough to merge with Obesity UK and form a very strong organisation now in the UK for people. I'm also involved at the European level. It was nice to see Jason this morning. I'm the chair of the European Coalition for People Living with Obesity. I'm a trustee of the Association of Obesity, and I forced my way in there 10 years ago because I felt they needed a patient voice. And I think that's really important. So this is, as Paul said, it's not new, but this way of doing it, the systematic approach is new. And I think that's really important. And you know, this is the best job I've ever had. I'm the PPI lead in the hub at Leeds Beckett University Obesity Institute, and I'm so proud to be there. Next slide, please. So people have talked, and I'm not a scientist, and I understand a bit of the science, but I know it's a chronic relapsing progressive disease, and so many times I have to tell people it's not their fault. It impacts on every aspect of your physical and mental health and social consequences. And I've lived with some of those changes. And I understand, but no two people living with obesity have the same life course. And we need some better personalised care. It's a gateway, as somebody said, to many other diseases, diabetes, cardiovascular problems, and cancers. But I think one of the things for me that's really important is about the impact on quality of life and length of life. And I think that's really important in understanding. And I think the work that I've seen already in Leeds Beckett is going to make a fantastic impact on those areas. Next slide, please. So I think it was Saeed who said at the start, it's a bit of a mouthful. Public and patient involvement and engagement. And I'm going to, if I say PPI or PPE, please forgive me, but it's all interchangeable as a term. It's research that's carried out with or by patients, not onto them. And I can remember being tested many years ago. That isn't PPI. I think that there can be a huge range of things, from a simple conversation, just listening even. And I think researchers can always do better if they listen. It can help researchers define a research question, and we've got several people now through Obesity UK who are funded co-investigators of a big research program grant. But the great thing is it can be everything in between. And I think that's really important. We're not going to force people into a role that they don't want. And it's always tailored to the member's interest and available time. Because one thing I think researchers can forget is that people living with obesity have lives too. And we can't always just turn up when you want us to. Next slide, please. This is really fundamental in terms of PPIE, because we need to meet the needs of public and patients that we serve. And if we don't, I think we'll have failed and we'll have missed a huge chance. We need a person-centered approach. You know, I've been around in health service as a consumer for many years and mental health services, and I undertook some studies there as a patient, and they weren't always driven by what patients needed. They were driven about research. We need the voice of lived experience loud and clear and front and centre, and it needs to be equitable and inclusive. All populations, and Paul did a very good job talking about the younger population, which I think is very underserved at the moment. But I also think we've got to look at people from the older end of the spectrum, including myself. And, you know, I was talking to people this week who are worried that they're too old and that for services. And there's lots of least heard communities is a favourite phrase of my direct supervisor. And I think we've got to look to engage them in the best ways we can. And you've got to sometimes go and meet people on their ground. There's no point sitting in a university expecting people to come to you. I've met too many people who live in ivory towers, I think is the expression. And it's very hard to climb an ivory tower from the outside. Not that I've ever seen one, but if I do, I'll let you know. The other thing that I really want to say is one of the things I love is talking to students. And Jason, who's just been on, about 12 years ago, he first introduced me to his psychology undergrads at Liverpool, and they were like blown away by actually being able to talk to someone who was living with obesity. This was in the appetite and obesity module, and now I'm a regular feature. I feel a bit like I'm prodded, and some of the questions that people ask are, shall we say, difficult, but I think it's important. And at Leeds Beckett, I've spoken to dietetics at both masters and undergrad level, and next week I think Louisa and I are speaking to some physios, but I want to speak to everyone because I think that lived experience. I don't want you to think this is a PPIE is all about Ken Clare, because it isn't. Part of my job is to get an army of people in PPIE who are going to come and do it. But all of our work will be underpinned by that. Next slide, please. There's some pressure points. If you don't communicate, it won't work. And I've learned that so much. If you don't tell me when the meeting is, don't send PPIE members to a meeting on their own in a big room full of 20 people and there's one PPIE member. You look around the room, everyone's a professor, and you're the only person in the room who's not being paid or not being valued or listened to. It's very intimidating. And guess what? You never come back. A bit like Paul's experience that he related to. We remunerate people at the NIHR rate, so we make sure that people get fair payment for fair days' work. And I think that's really important. But it's not just about pay. Some of the real value in signs for me are being listened to, about changes being made, and about moving forward. Just at the bottom, the one thing I hate is being just there to tick a box. And some of the grant applications, you won't get it unless there's PPIE involvement. But I won't just tick a box. And if you ring me up at 3 o'clock on a Friday and say, will you be a PPI co-applicant on this £2 million application, I won't do it. I want to be involved before that. Next slide, please. This is going to be integral to everything we do. I was a bit frightened last night when I read the slides for the whole presentation because I've got a bigger job than I thought. And PPIE members are going to be partners. They're not going to be just like people who we just roll in. They're going to be people working with us. They're going to help us design, shape and co-produce all the research we undertake. And the core values have come through: care, compassion, collaboration, equality and inclusion. I'll keep saying them because I think we have to. We'll always use person first language, but people will make mistakes and we will point it out to them. We'll do it gently at first, but then we might have to use a more blunt instrument to make sure they use it. And we're going to work to eliminate weight stigma and bias. We're also working, as Paul said, with Obesity UK and closely with the Association of the Study of Obesity to provide a national hub for PPIE in obesity research. Do you know what? This is the first centre of its kind in the UK. We're breaking new ground. It's a learning journey, but this hub is critical in breaking that new ground. I am so pleased to be here. Next slide, please. We've talked about our values before, but I just want to, I'm not going to read the slide. You can watch it again on catch up because I know you want to hear it because you missed some of my jokes the first time. Respect, support, transparency, responsiveness, fairness of opportunity and accountability. And the sentence at the end of each of those is saying that's for researchers, research organisations and hub members. It's a two-way street and I think that's really important. Next slide. Do you know, we've got a fantastic community we've got a fantastic committee steering group and I'm really super pleased to be in the chair for that. And I've got a fantastic deputy chair, that's Saida, who keeps me on track. But do you know, the stunning thing about this committee is, and I'm not going to go through everyone, we've got 8 people with lived experience of obesity on there. And I've never been on a committee with that many people before that wasn't a patient organisation. I'm so proud of that. I want to give also a shout out to the collaboration we're doing with the Obesity Empowerment Network with Maggie Clinton, who's been a fantastic advocate for many years. So I think that's really going to take off. Next slide, please. So I just want to say, if you want some information on the word that I can't say, that's PPIE, there's my Leeds Beckett address. If anyone who's listening or anyone you know, because we all know people living with obesity wants help or support, there's my Obesity UK address, or you can just Google Obesity UK and I'll point you in the right direction. And if you want to join the hub or you want to get involved in activities, there's the email address. So I'd just like to say a big thank you now. I think that's it. And I'd like to introduce you to Louisa Els. Thank you.
Thank you so much, Ken, and we are so privileged to have Ken as our PPIE lead. So for those of you who don't know me, I'm Louisa and I'm a professor of obesity here at Leeds Beckett University, and it is an absolute privilege to be co-directing this new institute with Paul and Carlton. So what I would like to do over the next 5 minutes is to take you on a little bit of a whistle-stop tour of our research excellence within the Institute. Next slide, please. So really at the heart of everything we do in terms of our whole Institute activity, but particularly our research activity, is collaboration, compassion and transparency. We've already heard that obesity is a highly complex, multifaceted, chronic relapsing disease, and to address this, we urgently need a step change in obesity research. Therefore, collaboration is absolutely key to bringing together the critical range of skills, expertise, and sectors that we require to make this effective change. This includes public and patient involvement and engagement, which Ken has just given us a fabulous overview of, but this really does underpin every single stage of our research, as Ken said, from the initial ideas, conception and development right through to the dissemination and translation at the end. And it really is critical to us in terms of facilitating our compassionate and person-centred approach. And of course, co-production with our policy and practice stakeholders is absolutely critical. Critical in helping us to understand what the real world problems, needs and questions are, and enabling us to work in co-production to produce highly applied obesity research that is not only timely, but importantly useful and usable. Therefore, Transparency and governance is absolutely critical to absolutely everything we do and will be the foundation to all institute activity. So next slide, please. So onto our research objectives for the Institute. So these are to build on our portfolio of highly applied obesity research, to identify new research and collaboration opportunities, as well as obviously continuing to build upon our extensive existing networks and partnerships with national and international partners and stakeholders. We are here to support new funding applications and to establish the core principles and values for the research that we support. And this is to ensure that all of our research is person-centred and provides real-world solutions to real-world problems that will ultimately make a real and tangible difference to the lives of people living with or at risk of obesity. We will also develop our PPIE hub that Ken has just taken us through, which will be fundamental in underpinning all of our research activity. We'll also try and identify any obstacles to effectively streamline our research supports and processes, and we'll develop a robust funding strategy and build research income and, importantly, impact. Next slide, please. So, really underpinning this research strategy, we have three core research themes. It is really important to note that there is considerable crossover between these themes, but we really wanted to use them more to illustrate how our research is really building upon our existing strengths and expertise. So these three themes are, firstly, weight management and well-being. So this theme will really build upon our extensive history in weight management evaluation and programme development. So this includes our developmental and evaluation work with More Life, providing academic consultancy to and undertaking tenders for the Office of Health Improvement and Disparities, and also our significant growing portfolio of NIHR funded research, which includes the evaluation of the new NHS England low-calorie diet programme. So our second theme is around tackling disparities and public and patient involvement and engagement. This will build on the work of the PPI Hub, but also the university's established community engagement work and some of the absolutely fantastic work that our migrant health group has undertaken. And we'll be bringing together this expertise to ensure we're starting to develop new, culturally competent, compassionate and person-centred weight management support for our least heard and too often underserved communities. And so our final theme is around systems approaches. So this will very much build upon the extensive programme of work that we've undertaken with the Office of Health Improvement and Disparities, and formerly PHE, on whole systems approaches and to obesity and the guidance that supports this. So this programme and theme of work will really help us to provide a step change in complex systems approaches, both for the prevention and the treatment of obesity. So next slide, please. So with that, I would just like to say a huge thank you to everybody for coming along this morning and for listening. And it's a great pleasure to pass you over to Carlton, who will be chairing the Q&A session. So thank you very much.
Okay, thank you very much, Louisa. Good morning, everybody. And if I can just extend my welcome to the event. My name is Carlton Cook. I have the privilege of being a co-director with Louisa and Paul of the Obesity Institute, and we're also under the careful guidance and leadership of Saida, who's supported by Laura, who very much are helping us move the Institute forward. So it falls to me to chair the Q&A session. We have got some questions that have come in through the Slido website. It's not too late to go onto the Slido website. If you Google it, it'll come up very quickly, and you can see there on the holding slide. If you go to slido.com, and then you enter hashtag LBU Obesity Institute, and then you'll be able to type in a question there. And also there's an opportunity to click on the thumbs up if you feel a question that's already on the list is a really important one, and that will promote it up the order. First of all, before we get into the detail of the questions that have been asked, I just want to pass on apologies. We were going to be joined today for the Q&A by Jamie Blackshaw from OHID and also Liz Boniface from Leeds City Council, but unfortunately both were not able to join us today due to circumstances beyond their control, but they really did want to send their apologies as they were very disappointed as they were looking forward to joining us for this event on World Obesity Day. So first of all then, and please do bear with me as I navigate my way through the questions on Slido, but I'll try and bring them to you in something of a logical order. Just to say, in the time we have available, if we don't get through all of the questions that appear on Slido, we will answer them. We will give answers to them, which will then appear on our social platforms and website. So anything that we can't get through in terms of questions posed for today will be answered, and that will be an opportunity for you to access our social media platforms in order to pick up on those answers should you wish. So just bear with me a second. Okay, so we're going to start off with the first question, and this is one for Louisa, I think. She hasn't had much of a respite from delivery of her slides, but and that is how do approaches to weight management interventions need to change, and how will the Institute steer that change, Louisa?
Oh, thanks, Carlton. And that's actually a really important and a really interesting question. And I guess what I would say is that despite the many years of research and interventions, we know that there are still too many people who are living with obesity. As Peter mentioned right at the very start, the numbers of people living with obesity has hugely increased over the last decade, and these numbers aren't falling. So we know certainly from a prevention point of view, our current prevention strategies aren't making the impact that I think they should be. And in terms of treatment, I would say certainly the kind of current short-term sort of 12-week treatment packages that are so often delivered. Firstly, they're often not accessible to some populations, and that's just kind of driving further health inequalities that we're very keen to tackle. But also, importantly, they're really failing to provide that long-term effective support for the highly complex, chronic, relapsing nature of a condition and a disease such as obesity. So I think in order to tackle this complexity, we really need to start thinking innovatively and differently about how we manage obesity. And I really do hope that the Institute will really lead the way in this innovation by bringing together the range of skills and expertise and sectors in order to achieve this. But importantly, by putting people living with obesity across our broad and diverse communities truly at the heart of all our activity. And to me, this is absolutely critical. If we're going to develop effective, compassionate, person-centred approaches that meet the needs of people living with or at risk of obesity in order to eliminate inequalities and really to ensure we're providing everybody who needs support and care with the tailored support and care they need, and provided importantly without prejudice, stigma and bias. And again, that relates back to Jason's introduction at the start, and this is absolutely critical, and this is where I really hope the Institute is going to help us lead the way.
Okay, thanks very much for that, Louisa. So looking at the questions on Slido, there's a number now that are coming through for Ken, focused around PPI&E, and so if I start off, there are a series of questions, Ken. So you're going to be on for a while, I'm afraid, but I'm sure you're up to it. And I think people are probably posing them partly because they want to hear more of your humorous jokes. So we look forward to those as well. But just on a serious note, just to get going in terms of the first question, could you give an example of how PPI&E will influence work within the Institute?
Thanks, Carlton. That's a really good question, and I think we've got a real reference point for that, which is, I think it's been alluded to during the morning. I think Louisa spoke about it. Our evaluation of the very low calorie diet program, and I was involved in that before the application stage, and I think we got a small grant to put together a PPI group for the application. The application was then successful, which was I was really pleased for that, and we developed a small but perfectly formed and diverse group of people who support each other through the PPI process. And we've been involved in lots of different activities with the project, shaping questionnaires, shaping information that's given to people who are on the scheme. And it's not been easy. I think that's one of the things I'd hate anyone to, if PPI&E was easy, we'd have all done it years ago. It needs some work. And I think what we've demonstrated in the remission project is that it can be done and it can make a difference. And we've learned so many lessons. And I think the other thing is the researchers and the PPI group members have all enjoyed it. And we're all richer for the experience. Thank you.
Okay, great. Okay, that's great. Thank you very much, Ken, for that. So carrying on the same theme, Ken. So you're on again. In fact, this is going to become the Ken Clare show for about 10 minutes, I think. So, but that's a good thing. That's a positive thing. I think it also shows the genuine interest there is in the approach to PPI&E, which is important. So we've been asked a question, and this is, my childhood was key to my later weight problems. How are you going to cover childhood within PPI&E?
Well, I think that presents us with a challenge always, and there are some groups that are always difficult to recruit, and children and young people are a major one. And I think there's issues about parental involvement with the children and young people. We're fortunate in that we've got Paul's experience in that to call upon, but they are always been the most difficult group to recruit, because we've done quite a few. We've collaborated with people via Obesity UK and getting people to take part in research, because I think it's such a sensitive area that it's got to be done properly. I don't know if Paul wants to add anything to that.
Yeah, I think you're right, Ken, and I suppose we're on this journey, and I suppose what I've tried to outline is our work in this space of appreciating and listening to those people with a lived experience of obesity has always been a fundamental part of what we do. Where we're at now is we are formalising that, structuring it, creating resources, plans, focus, support that will enable us to really move this forward. And what we see is collections of underserved communities in this space of obesity, and children and young people are one. And Ken's absolutely right. It's hard to do for a number of reasons, but that would be part of our ambition. And if we think about those broader health disparities that we're also trying to tackle, there are many groups across those that are suffering health inequalities that we will really need to work hard to focus our attention to collate the members of those groups, to understand their needs, to understand the ways of working, and therefore, all the underpinning activities that will enable us to do a really good job. And I guess that's what I'm really excited about. And this is the first step, and we're really clear on that being the first step. We think it's a really good first step when you have got someone like Ken, and then not just Ken, but the what I would argue is the attitudes, beliefs, and passion that our whole team have for enabling people with a lived experience of obesity to be part of this journey and to be a leading part of this journey for all of us. And so, you know, watch this space. It's a great showing in people. And watch this space is all I'd say.
Okay, thanks very much for that, Ken and Paul. And so we're going to come back to you again now, Ken. You're not off the hook yet. So basically, a couple more things really, and this is a question we've been asked. And again, it's a general question, I guess, but I think probably from your perspective, it is this issue of getting things communicated effectively with the public. So the specific question is, how do you plan, as in not you specifically, Ken, but the Institute, but how do you plan from your perspective to get the vital information over to the public? So I guess from your perspective, Ken, what are the important drivers in communication to get our messages out and into the public domain?
Thanks for that, Carlton. That's a great question. And I think there's two elements to that. One is about recruitment of PPI members. And I think that there is no one set way for recruiting people that works for every group. And I think we've got to look at that and find and meet people where they are. And that can be very, you know, traditionally, I think we've sort of put it up on a Twitter feed, put it in Facebook, put it in a doctor's waiting room, which nobody can get into at the moment. But I think we've got to look at community settings where people, and we've used faith settings, community radio. I think we've got to look at recruitment's got to come in a range of ways. And then the other one is about feeding back our results. And if I had £1 for every PhD student who's come to me over the last 20 years, said, can you help me recruit some subjects? Because that's the word they used to use, you know, that's not my word. And we've encouraged, we got people and we never heard from them ever again. And what I'd like to do is that if people, you know, are doing a study, that it's fed back to the people that were part of that study in a format that the people will understand. And I think that's really, it's difficult, but that to me should be part of the, I don't know what you academic people call it, but I think for me, that communication of results in a format that the people who are in the research can use and understand. And probably they need to be involved in what that dissemination looks like. You know, it's not just about going to a conference or getting a paper, but and I understand the need for that. But I think it's really disheartening when people have taken part in a research project and not heard anything else about it. So that's one of the things I think I'll be working on. I don't know if anyone else on the panel wants to pop in and rescue me.
Go on, then I'll have a go. I'm very generous by nature, Ken. But just to say, I completely endorse everything that Ken has said there, and I think it's kind of represented in the profile that public engagement now has for universities. There is a clear expectation of all universities to engage more clearly and in a focused way in terms of public engagement. And so it is really a test and a challenge for all universities to make sure that they interact with their various constituencies and the public to get their messages out. As Ken rightly says, it's not about just going to academic conferences and presenting academic papers. This is about actually mixing with constituencies, communities, and meeting them on and in a way that best suits them, not that is best related to how we generally would do things in the university. So I completely endorse all the things that Ken has said, and as I say, that's now effectively what all universities are currently engaged in trying to improve in order that we can get our communications out there. So there's one more question. I promise this is the last one, Ken, but it's quite a specific one really for you, and that is what would you say to anyone thinking about joining the PPIE hub?
Well, I think the first thing is to drop me an email or via the email that was put up at the end, via me Leeds Beckett, and we'll have a chat. And I think it can be from 20 minutes a month to a lot more than that. I think we're looking for, and if people haven't got all the skills, we'll help them develop some of those skills. I think that's in our vision for, you know, we're new, and I think that's part of our vision. But I think the first step is the hardest. But any person living with obesity has got something to contribute. And I think that's really important. And that we want to hear voices and amplify them. And I think, you know, I'm quite happy to spend some time as part of my role listening to what people want to do and what they want to take part in. And I think it's really important. I think Louise has said it and I've said it. We're not going to make hub members fit projects. We're going to do it the other way around. I think that, you know, there's no point being in an uncomfortable situation. And I think we've got to remember that people are sensitive. And that we support them. And I think that's really crucial, that we don't just put them in a difficult situation and walk away. And we won't do that. And it's a very simple thing, and I think I mentioned it, there'll always be 2 PPI members in a physical meeting, because you can get there early, have a chat and buddy up. And when everything's all a bit confused, it's easier to ask when it's 2 of you.
Okay, thanks very much, Ken, and thanks very much for answering all of those questions. As I said, I guess it's no surprise that the PPI element has actually generated a lot of interest, and thanks for those clear and insightful contributions. As always, very helpful. So we're going to move on to Louisa now to take the next question, and this is from John Preston. And John's question is, we can improve quality of life using the social model of disability. What connections will the Institute have to disability rights activists and researchers?
Thanks, John. And that is an absolutely brilliant question. And I think working with those groups, particularly within that second theme around tackling inequalities, is really, really fundamentally important. So I would like to be engaging with those groups as part of that research theme in itself, but also I'd be really keen to engage those groups within the PPIE activity as well. And certainly some of the research that I'm involved with in collaboration with the University of Glasgow is involved. We have a large involvement with adults living with a learning disability, who have really been fundamental in helping us to steer our work around improving and understanding lifestyle interventions for adults living with learning disabilities. And I guess I'm just passionate about increasing engagement with these currently underserved communities, to ensure that we really are providing equitable care and support for everybody that needs it.
Okay, thanks very much, Louisa. Thanks for that answer, Louisa. Very helpful. Then I'm just looking at the question. The next one we're going to come to is for Paul. I think he's commented and written a piece on this particular report. So the specific question, Paul, is, given the recent NCMP data, that's the National Child Measurement Programme, how does the Institute see the balance of effort and investment in treatment and prevention of obesity?
Yeah, thank you very much for that question. I think it's really important. I think the data was for me very shocking, very worrying, and I think, you know, many of our colleagues across the space sort of recognise that. For those that don't know, what we saw was a significant uplift in levels of obesity in children and young people over the course of that sort of 1 or 2 years during COVID. What we also saw, which is equally as worrying, is the sort of gap and therefore the gap between those more deprived communities and those more affluent communities, and the widening of that gap and really demonstrating health inequalities. And so what we feel is the work that we're doing at the Institute is really, you know, on message, thinking about treatment and prevention and getting that balancing between the two. I would argue, although I'm biased because a lot of my work has been in the treatment space for a very long time, is we do have a disparity at the moment. And if we look at the policy action is much more aligned to prevention. And whilst that is important, with the data now showing 1 in 4 of our children have a problem, you can't prevent a problem that people already have, really demonstrates we need to start to see that shift. And, you know, and our work will articulate how, why, and why that's important. Obviously, that health inequalities dimension of the work that Louise has been talking about is absolutely critical, because that in itself is about how do we really understand the multiple needs of those multiple groups and providing multiple approaches for that. And that again feeds really nicely into our work around systems and systems approaches, and understanding the multiple drivers and multiple factors, but also time as a key feature. And you know, what the NCMP data and the sort of significant uplift in childhood obesity rates, and let's put that into context. In our children aged 11 was nearly a 50% increase in children living with obesity in that 1 year period, and that is a significant shift. And of course, our work in whole systems, the dynamic nature of a system and recognizing that things change is really important. And so we're really excited by the fact that we feel the sort of direction our institute is going in is very much aligned to enabling us to be part of answering that question, that really important question that somebody's just posed.
Okay, thanks very much for that, Paul. We've probably got time for one more question, and so I'm just going to jump over the order a little bit because it's a contemporary question. So I'm going to come to Louisa next and just ask Louisa to talk to how has the COVID pandemic impacted on obesity?
Thanks, Carlton. That's a really good question, because the pandemic has really had a significant impact on people living with obesity in several different ways. And I think this is highlighted really in 2 recent pieces of work we've undertaken in collaboration with the Office of Health Improvement and Disparities. And the first was an overview of systematic reviews, where we actually looked at the relationship between obesity and COVID-19 outcomes. And the evidence from this really does suggest that living with obesity is associated with both contracting COVID-19 and also more severe outcomes such as hospitalisation, ventilation and mortality. So that was a really interesting finding, but also some additional survey work that we've undertaken with colleagues at the University of Leeds and UCL, which really clearly demonstrated the impact the pandemic has had in terms of reducing access to weight management services and support, but also the adverse impact it's had on behaviours that are related to weight gain, such as things like an increase in emotional eating and reduced activity levels in people living with obesity. And I think that also kind of goes back to what Paul was saying about the really kind of concerning increase that we've seen in the latest NCMP data. You know, there's kind of ingrained of some of these sort of negative behaviours around that are supporting weight gain, so a real concern. So I think, you know, now is such a good time to launch the Institute, because there's so much we need to do to support everybody who's living with or at risk of obesity.
Okay, thank you very much. Thank you very much for that, Louisa. And so we're out of time, I'm afraid, in terms of the Q&A session. I'd just like to thank everybody that posted questions. We've still got a great list of questions that we will, as I said before, we will address those questions and we'll post on our social media platforms answers to those questions. But thanks everybody who posed a question, and thanks also to the panel who gave really good comprehensive answers to those questions. So I'm going to hand you back to Saida now.
Thank you, Carlton. That just leaves me to close out the event this morning. I'd just like to say a really big thank you to every one of our speakers and contributors this morning, and to our colleagues across the university and professional services that have worked really hard in the background to get us to this launch today. I hope you've all enjoyed it this morning, and I hope it has inspired you all to get involved. If you would like to hear more about what we're up to, you can follow us on our social media channels. Our contact details are on the screen. And one of the things that we will be doing throughout the day in celebration of World Obesity Day is we will be pointing to some fantastic activities of our external partners. So do look out for that. You have the details of our contact information if you'd like to join our mailing list. Please do drop us an email. And just finally to say on behalf of myself and the team, thank you all for joining us. Thank you for your support and enjoy the rest of World Obesity Day. Goodbye, everyone.